private resources and assets, but also have them available regionally or to the state, and figuring out those details of how that works. So for example, we know a healthcare facility has X equipment or Y. How can we use that to better all of Texas if it was purchased with these funds and coordinated through these activities? So these are some efforts we're going to look at on the preparedness side. Certainly, hurricane season is coming up June 1, and we're preparing as usual. Have our teams rostered. We're continuing to update our response operating guidelines, working with our folks across the state. And we'll continue to work with our RAC partners to create our emergency medical task force components. And we've had a couple of road shows with those in local jurisdictions, and we've got some coming up in Houston in the Woodlands area, El Paso, and Lubbock. And then we'll have an air evacuation exercise in Corpus Christi next week. So a lot of activity there, both programmatic and practical on the response side. Related to cardiovascular disease, May is CVD and Stroke Awareness Month, so I wanted to make that out. We had our Cardiovascular Disease and Stroke Council meeting last Friday as well. We are currently seeking new members to this council. This is an advisory council to our department and to our health promotion chronic disease prevention program. And if you are interested in serving on the Texas Council on Cardiovascular Disease and Stroke, please contact me, or if it's easier to go through Chief Riley and to me, whatever's easiest, but you can find me and I'll connect you to our staff and put your name in the hopper as a potential applicant. We've been developing our strategic plan and state plan to address cardiovascular disease and stroke. And of interest to GETAC, I think, are three areas. One is to increase collaboration and leverage our existing resources with GETAC, increasing resources available to advance prevention efforts and improve the system of care for heart and stroke patients, to improve and increase and expand our EMS-wide protocols and guidelines for the early detection, treatment, and management of CVD and stroke patients, including working to promote the improvement of EMS response delivery times. And then we continue to seek out any collaborative opportunities between our Cardiovascular Disease and Stroke Council and program and GETAC. And so there's some issues, and again, if you're interested in learning more, wanting to participate, please contact me and I'll be happy to connect you to our appropriate staff. And then lastly, we continue to support our cardiovascular and stroke prevention, heart and stroke healthy cities recognition programs. We've had 9 cities conducted assessments in 2011. Marshall, Nacogdoches, and Tyler earned gold. Bryan, Georgetown, Longview, and Temple earned silver, and Harlingen and Odessa earned bronze recognition levels, and that covers approximately just under 630,000 Texans to be impacted in these communities. And then we have another number of communities being assessed in 2012. So our next Texas Council on Cardiovascular Disease and Stroke meeting will be in August 4th. And then I think in a couple of the committee meetings there's some discussion. I know we've been working on a survey, RACs on a survey for cardiovascular disease and stroke data. That data has been cleaned, tabulated, and compiled, and we're basically in the process of analyzing that data and hope to have it, barring any significant change in resources over the next few months, should be completed and available at your upcoming meetings. Okay, let me now talk trauma registry. A lot of discussion on trauma registry this week, and I'm glad for that. I think it was a healthy discussion. I think we wanted to show a slide, and I don't know if we're ready to go. Is that? And I know my forgiveness to those who've made it this far in the week. You've probably seen the slide, and that's okay. Repetition is good for learning and for adult education in particular. And we'll just walk through. I'm going to do high-level overview, and I won't give you the full 1-hour presentation. We've had some very good, positive discussions. I know there's naturally lots of questions about the registry and moving forward. This is a big process. Could we hit the first button, and I think it'll come up. I just want to what I'm going to do is outline for you the kind of by quarter where we are in this process, and I'll keep that there for a second. Let me talk through first, and then we'll get to that real quickly. Again, we've been updating various committees, the Trauma Systems Committee, I believe, on Monday, RAC chairs the other day, and several others. Very good discussion. I want to, I understand people are always wondering, what's going to happen. It is going to be new. Kathy mentioned, at some point, we're going to have to go back to reporting and what was required. But I guess I want to tell you right up front, we're going to work with you. This isn't a go live and then we'll see you in 10 years, okay? That's what we're going to do is work with you. We want to continue to see improvements over time to this system. We're going to work closely with Kathy and her shop as you begin to submit the data and what's required by state law, and work with you to do that. So first of all, I want to let you all know that we're not just going to flip the switch in August and then we're back to business as usual, as we were a couple of years ago. So it's a process, and we want you there, and we need your input and help and support along the way. So we are scheduled to go live August, September date. I just confirm because I want to give you an update on some issues that have been affecting multiple state agencies and what that impact might mean to trauma, and I'll tell you about that in a second. But let me tell you, so basically what we're looking at, database conversion, 22 million records to a new data model, which will include NEMSIS and NTDB as standards. So it's just huge. This is by far one of our largest registries. It's probably larger than multiple combined states. So I need people to understand that this is just a huge, huge project. We're facilitating that transition from old to new system by completing legacy hospital and EMS data import interfaces, so that, again, EMS and hospitals can continue to same the exact file format that they currently send. So trying to minimize impact to reporting facilities. Working on data validation rules and conditions to ensure the data are sufficient quality to meet your needs for system improvement. And I think we've heard that. I know Jory has spoken at a hearing about that. We've, really hearing the need for valid quality data and moving that, so working to assure that and building in those systems so that it can catch those errors, if you will, up front, and that way we can correct it before you ever hit send. And then we'll provide you, certainly, I think the other point is people want to see this, and as we're building this, and we understand that, and we're setting up sometimes, and I'll share that with you in a second, so that you can actually see demonstrations of the current system as it's built, explain how it works, hear your thoughts, continue to get your input, answer any questions, and see where we can make modifications to support you. I think we plan 2 webinars, June 5th and 7th, to go through that. And then we're also working with TTAF. We're going to be working with TTAF to hold a kind of hands-on session where people can come and actually play with the, actually work it and see how it works. And so there will be that, and our vendor Consilience will be there to answer any questions and work. So we got a couple webinars coming up in June, so you can start to see those functionality, and then an actual session where you can get your hands on and do that. So we heard you, and we do want to do that. In the next quarter, that third July middle green slide there, we're going to be doing user acceptance testing. So here's yet another opportunity for people to provide their input, facilitate pilot testing, and then, of course, we'll look towards system rollout, where you'll be able to send data into the system and have some capacity for ad hoc reporting. Then after go live in that 4th quarter period, October through December, what we'll be doing is developing further customized reports. Just as a note, I think we heard over 200 reports that people wanted. Now, I'm not sure we are going to use 200 reports, but we might use a few. I'll give you just a sense. Some of my other registries probably only have about 10 or 20 reports, so there's a lot of reporting function that people want. I think we've been working with folks to prioritize, like what's your top 10 that you need immediately, and then the next, and then we can start to work with you all to build those reports. We're going to be implementing a registration enrollment portal for new facility registration, and with improved capability for managing your user account, so you can kind of do that at a single time. And then we'll be also gathering and documenting any feedback, of course, that you all have on the system, so that by the 1st of next year, so January 1, 2013, we can begin to analyze, prioritize any requested user changes, and create an enhanced version. And I just want to say that I think throughout this process, your involvement is extremely important. We want to design a system that provides quality data for us, for all of us, to improve trauma care in Texas. We've been working with our Registry Solutions Work Group to review rules and conditions that have been created for data and data submission and validation steps for processing data files. And we're going to continue to do that. And that's going to take some time, by the way, like several weeks. At go live, all the current user accounts will be migrated to the new system, and we'll provide training on how to access the new system and how to submit data in the new system. And again, we're going to work with you during that time. And you heard Kathy say, we're going to transition this over time to assure that everyone understands how to report, how to use the new system and how to report. During the first year after go live, we want to work with you on transitioning from currently reported data elements to reporting the full set of NTDB and NEMSIS data elements. And we also understand that folks, that this may incur a cost to our reporting, to our facilities, due to local vendor software configurations that will have to be done. And we're working with you. We're working to define those specs, and we'll work with you over time to define that, and so that it can align with your budget cycles, and we assure we have that, you have that funding available to you to make those necessary changes. So I think that was very good feedback that we didn't receive until the meeting on Monday, and I think that was very helpful for us to hear that. And then of course, we'll have to do file specification for submission of NTDB and NEMSIS data to the new system and to share with our vendors. And then upon completion of the pilot testing and user acceptance testing, we'll do that, share those specifications. So we've got to get through user acceptance testing and the pilot testing, and then we can share the specifications. Then you can work with your vendors and build that. So we understand there's some timelines that will have to be aligned over time, but we'll work with you all to do that. We have asked the RAC chairs to help us create a new process for obtaining business associate agreements between the RAC and entities in their area to ensure that we are in alignment with HIPAA. So we just have to follow the law about how we exchange personal health information between us and among us. And so we're working with the RAC chairs to define that. And then lastly, I know there have been some comments. I think sometimes we have to recognize not only, I think some folks' facilities use this as their local or regional registries, but also the state registry function. And sometimes the state registry functions are in addition to what you may need, or you may think that, well, I don't really need that function, but we at the state level do. So for example, one area is our funding partner, TxDOT, has volumes and they're a very important partner. They're provided funding for a registry replacement to the tune of several $1 million over time, that we want to work with them to link their motor vehicle crash data, which is just a wealth of information. As you know, motor vehicle crashes are the leading cause of trauma in Texas, probably in the U.S. as well. And it's an important process for us to be able to link that data and see that spectrum from the crash site through the episode of care. So it's very important that we begin to look at that comprehensive picture so that we can begin to see, one, the true impact and cost of that, but also potential intervention points. So that's an important piece at the state level. I know it's been a long road since 2007. It's been a long time. I understand that, and I understand people are asking why does it take so long? As you know, this, as I mentioned, this isn't. This is not your office suite product that you can get at Best Buy and just plug in. We're building a system for a state the size of France or some countries to support over 640 hospitals and 1,200 EMS reporters, 22 billion records, as you see, and growing as Texas grows, and trying to meet many needs at the state level and, of course, the local and regional level. We're fulfilling multiple legislative mandates, like we have too, as part of this, and so we have to meet those legislative mandates. It's taken time to get requirements from our stakeholders and users and put those resources together and begin to select the vendor and begin that vendor work. So that took time.